So today we're going to discuss eating disorders, which is chapter 12 of your text. This is going to be a bit of a shorter chapter. We're going to be talking about some of the characteristics of eating disorders, understanding eating disorders, and treatment for eating disorders. This is a topic that fascinates a lot of people because we have a strong sense of body image in our society, and so people are always looking for the next diet or ways to look better. And so when people have these fluctuations in weight, this is something that people are very interested in. There's almost a morbid fascination with it. So most of you have probably heard about anorexia nervosa, and those are people who starve themselves for very long periods of time and remain convinced that they need to lose more weight. So they look at themselves in the mirror even though they're completely emaciated, and they see, you know, all their flaws, and they feel like they're much larger than they actually are. People who have severe anorexia actually have amenorrhea, where they have those women who've begun to have their menstrual cycle or periods actually stop menstruating because there's not enough body fat. There are two main types of anorexia: the restricting type and the binge purging type. In the restricting type of anorexia, people refuse to eat and or engage in excessive exercise as a way of preventing weight gain. And then people in the binge purging type of anorexia nervosa also engage in binge purging behavior, but different from bulimia, these people are still significantly underweight. So this is a comparison table of eating disorders. So if you look at kind of across the board for binging, people who have the restricting type of anorexia don't, but people who have the binge purging type of that, bulimia and binge eating disorder, do. There's purging behaviors in the binge purging type of anorexia nervosa and bulimia. And there's also a lack of self-control for those with bulimia and binge eating disorder, and those who have binge purging type of anorexia nervosa. Bulimia nervosa is binging followed by behaviors designed to prevent weight gain from the binges. So binges is periods of uncontrolled eating. And this is not, we all have more than we should. Like, I just ate a big tub of popcorn at the movie. Potentially a binge, but not what we would define clinically as a binge. Binging is eating in a 2-hour period an unusual amount of food, and generally eating much more rapidly than usual. So this would be like, I remember, and this is going to be before your time, but I remember there was a made-for-TV movie when I was a kid, and it had the mother from Family Ties in it, and she had bulimia, and she would go into the fridge, and she would take whatever was in the fridge and literally shovel it in her mouth, just ice cream, cake, whatever. They tend to be carbohydrates and sweets that people eat. And then people engage in behaviors designed to prevent weight gain, like vomiting, using laxatives, diuretic, or other purging medications, fasting, or excessive exercise. Again, probably beyond your time, but I remember during Beverly Hills 90210, main character Jenny Garth, Kelly Taylor, at one point was engaging in excessive exercise after kind of engaging in purging behavior, binging behaviors. Generally, people who have bulimia are actually average to above average weight, because when you binge, your body still ingests some of those calories. Binge eating disorder resembles bulimia, except that the person doesn't regularly engage in compensation for the binge. They just eat a lot of food, but they don't necessarily purge. These people are significantly overweight and are disgusted and ashamed by their binging. It's more common in women, and it's chronic and results in high levels of depression. Other eating or disorders include partial syndrome eating disorders. So these are syndromes that don't meet full criteria for anorexia nervosa or bulimia nervosa, but have some of the same things, like people who don't binge as frequently or who maintain slightly below average weights, but not significantly below average weights. There's atypical anorexia nervosa, where all the criteria for anorexia nervosa are met, but the individual's weight is within or above normal range. Bulimia nervosa have low frequency or limited duration, so meeting all the criteria for bulimia nervosa, except with the binge eating and inappropriate compensatory behaviors, occur less than once a week and or for less than 3 months. So they have those behaviors, but they're not happening as frequently as they need for diagnosis. And then there's night eating syndrome, which is eating regularly excessive amounts of food into the night after dinner. Obesity, that's now considered to be an eating disorder. So people who have a BMI of 30 or above, it's calculated as your weight in pounds multiplied by 703 and then divided by the square of height in inches. It's associated with increased risks of coronary heart disease, hypertension and stroke, type 2 diabetes and cancer, low quality of life and emotional problems. And it's caused by living in a toxic food environment, so eating a lot of high fat, low nutritional value foods, and also by a lack of exercise. Popular ways to lose weight include self-help books, commercial weight loss programs like Jenny Craig or Weight Watchers, and their weight loss medications. Healthy ways to lose weight including eating nutrient-dense foods and avoiding foods with empty calories like chocolate bars, etc. You want to have a minimum of 30 minutes of physical exercise a daily. Structure your environment so that healthy choices are easier to make, so don't have those types of bad foods in the house. Make sure that healthy choices are available. Design your life so that you have exercise built into it. Park further away in the parking lot, and just being more active throughout the day. So in terms of understanding eating disorders, there are some biological factors. So there are some genetic factors. So eating disorders do tend to run in family. They tend to happen during changes in puberty when a girl's body changes. When they get hips, breasts, etc., the fat is disproportioned differently. You also see at this time sometimes a dysregulation of neurochemicals in the brain and lowered functioning of the hypothalamus. So there's abnormalities in levels of several hormones important to its functioning. If you remember, the hypothalamus is kind of important in regulating our eating behaviors. And then abnormalities in the systems regulating the neurotransmitter serotonin, and that's why which is also linked to depression, which is also correlated to eating disorders. There are also a lot of sociocultural and psychological factors. There's also the cultural and social pressure to be thin. Our media promotes it. You can see they still do a lot of airbrushing. Athletes also have a lot of eating disorders. There are cognitive factors. There are social pressures to achieve certain shapes or weights, and there's low self-esteem and valuing others' opinions too much. So people, who have mothers who say, "Oh, you're too fat," and that becomes internalized. There are difficulties regulating emotions, and so people who have a lot of negative emotions sometimes use food to cope. And then there's also family dynamics, and so people often will have families with eating disorders, and they sometimes find low parental warmth and high parental demands in families with people with eating disorders. There are also rates of eating disorders in different types of sports. For example, we see about 35% of women in figure skating and gymnastics actually have eating disorders because they have to be thin. Ballet as well. We also see weight-dependent sports like judo and wrestling. Both women and men have eating disorders because they have to maintain certain weights. About 20% of people in endurance sports have eating disorders. Lower in golf and in games like soccer and volleyball, where you require a lot of energy, and so having eating disorders would be difficult. So what are some of the treatments for eating disorders? Cognitive behavioral therapy. So especially for anorexia nervosa, you challenge the thoughts that being thin actually is being better or good, and then you reward them for gaining weight. Sometimes in the beginning stages you actually have to make people gain weight against their will, so they'll have to have tubes inserted in them depending on the seriousness of their weight loss. People can die from anorexia nervosa as well as bulimia nervosa due to an imbalance in electrolytes. Family therapy also helps, and so oftentimes people with anorexia are treated as a unit. Treatment for bulimia and binge eating disorder also involves cognitive behavioral therapy, where you teach them to monitor the cognitions that accompany the binge eating behavior. There's interpersonal therapy, where you discuss problems related to eating and develop strategies to help those problems. And there's also supportive expressive psychodynamic therapy, where the therapist encourages the client to talk about problems relating to the eating disorder, but in a non-directive manner. And finally, you have behavioral therapy, where you teach the client how to monitor their food intake and introduce avoided foods into the diet and coping techniques for avoiding binging. So there are also biological therapies. So people will take SSRIs, so those are antidepressants, to reduce binging and purging behaviors. There's a high comorbidity with depression, and so decreasing some of those depressive feelings will decrease the binging and purging behaviors. But this has failed to restore individuals to normal eating habits, so it's not the end-all and be-all. We also find that using antidepressants in anorexia can reduce symptoms because, again, there's a high comorbidity. In some cases, antipsychotics can lead to increases in weight with people with anorexia nervosa, although it wouldn't be a first-line treatment. And there's also anti-epileptic medications and obesity medications.